Hello everyone, this is Dr. Shishma Sarala, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about the most important connection of bulky uterus. Many of our walk-in clients as well as our online clients are asking this question, especially people who are just married or people who are going to get married, which is nothing but bulky uterus and its connection to pregnancy. So we're here in this topic today. We'll be discussing what is bulky uterus. First of all, what are the symptomatologies related to bulky uterus, and then is there any connection between bulky uterus and pregnancy, or do you have any complications that you will be facing if you have bulky uterus and you are pregnant? And then apart from that, if you're someone who's planning to get pregnant, if you have bulky uterus, will there be any sort of risk factors that you should be aware of, and what are the best treatment options? We'll be discussing all of this in this video today. So let's dive into the topic. So what is bulky uterus? You have to remember, see, there's a lot of medical definition. We don't want to get into that stuff. So let me tell you about bulky uterus in just simple 3 words. One is being non-pregnant, and then second one is having an enlarged uterus despite being non-pregnant. Third thing is having menstrual irregularities. Any condition which is a non-pregnant state, that is the woman is a non-pregnant state, but yet the uterus has become enlarged or bulky and is presenting with some irregularities in the menstruation, then that is how a bulky uterus is defined. What are the signs and symptoms related to bulky uterus? First and foremost thing is the irregular periods. See, as a woman, even if you're a teenage girl who has got her first period, have a habit of monitoring your period, the flow, how many days the blood flow is there, how many pads you're using, how frequently are you changing your pads, what sort of pads you're using, either it's XL, medium or double XL, and how frequently are you changing it, what is the color of the blood, are you facing any issues with clots, that is, do you have any blood clots in the flow, and then how is the color of the flow, do you have any leukorrhea, that is white discharge before periods or after periods. So by tracking all of this, if there is even slight irregularity, and you will be able to understand your body better, and you will be able to counteract it even when the original disease is yet to occur, like it has not even occurred, but yet you will be able to understand your body and treat it much better. In the starting stages, it is just some nutritional or some diet changes, but as it progresses, it can become a proper disease, a fully blown proper disease, and you need medication for it apart from lifestyle changes, right? So if you're tracking your period properly, you will be able to note even slight changes, and then you, even before even the original disease occurs, you will be able to counteract it, right? Primarily, if you have irregular periods, what is irregular periods, especially related to bulky uterus? You'll be facing menorrhagia. So what is menorrhagia? If the flow is too much or for too many days, if the flow is for 15 days, 10 days, 8 days, or even if it is for 3 to 4 days, the flow is too much, then the number of pads you're changing is too much. There is a number of clots that you're shedding down. All of this will come under too much bleeding or too much bleeding for a prolonged period of time, or a little bit of bleeding for even a prolonged period of time. All of this will come under menorrhagia, and all of this will come under the symptomatology of bulky uterus, right? What is the second thing is painful menstruation. You will be experiencing severe cramps. Not everyone, many people who are suffering from bulky uterus, majority of them will be experiencing cramps. And then you can experience abdominal bloating before and during your period. Frequent urination and constipation is always accompanied in features where there is bulky uterus along with fibroids. See, to know the signs and symptoms of fibroids properly, you have to know or understand the causes of bulky uterus. We've already done a video on bulky uterus and its causes. If you have not checked out the video, the link will be provided in the description box. Please do go and check it out so that you will have a better picture of bulky uterus. And then after that, if you're watching this, you will have a complete understanding of a pregnancy or conception, fertilization, complications and risks, right? So if it is complicated with fibroids, you will be experiencing frequent urination and constipation problems. Apart from that, there is always a dull, aching, chronic lower abdominal pain and swelling if you're experiencing or if you're suffering from bulky uterus. And then what is conception? See, if you're talking about pregnancy and you do not even know what is conception or what is fertilization or what is fetal development, how fetal development takes place, basic knowledge. I'm not telling you to get on to the layers of the zygote or layers of the the Graafian follicle that we are using. Sorry, I'm not telling you to have a full-blown medical study, but basic knowledge is very, very important. So for that, we need to know what is conception. So what is conception? Conception is a time period from where The sperm and the egg have united fertilization till the implantation period. Until that period, we can call it as conception, right? So in the conception period, will you be facing any problems if you have bulky uterus? We will be understanding in the next slide. So what is conception? The time period between that is the time period starting from the fertilization, that is the egg and the sperm meeting together, till the zygote or the embryo which is formed is completely coming down to the uterus. You know that fertilization takes place in the fallopian tubes, that is the tube that are attached to the uterus, right? It takes place there and it comes down and attaches itself to the uterus so that it has bigger cavity and can grow in a much better form. So until the implantation, that period is called as conception. Then what is fetal development? You have to understand that from the 8th or the 9th week till the 40th week, that area comes under fetal development. So why is knowing fetal development very important? Remember that fetus develops and it develops into a baby where the organs are being developed, the brain is developed, the reproductive system, every system is developed. The baby needs or demands a lot of blood supply. The baby demands a lot of nutrition. The baby demands a lot of space for it to move. So all of this will come under fetal development, right? So if there is bulky uterus, then there will be problems with fetal development. First, we will know from which week to which week is the fetal development taking place. We understand that is from the 9th week till the birth is called as the fetal development. Fetal growth is defined from 4th week to the 40th week. Okay, so slowly the baby will start developing. So this is where you will experience heartbeat of the baby, the movements of the baby. You will experience your abdomen growing. All of this you will be experiencing during this period of time. Now we will see how the bulky uterus impacts pregnancy. So let me explain it to you on better terms with a diagram so that you can understand it in easier manner. So here we are taking, here this is the uterus, right, and this is the fallopian tube. As you can see, these are the fallopian tubes and this is the ovary that is surrounding it. Okay, so fertilization takes place here, okay, or the conception period happens here. So if you're having bulky uterus alone, then this conception or fertilization might not be a problem. But if you have complication with fibroid and it is blocking this fallopian tube, then the sperm will not come and meet the ovary which is in the fallopian tube. So what will happen? Fertilization only will not take place. So that is the problem. Second thing, okay, there are no fibroids, baby, the fertilization has taken place and the baby has come from here till here. It has come and implanted here. Okay. So for this travel to happen, you should not have any fibroids here. So if it is complicated with fibroids, it is always a little bit problematic to deal that case. Once it has come and started here and implanted itself here, what will happen? That is, what are the complications you will, you will have. So remember that the fetus is demanding, okay, it is attached and it should grow, but you have fibroids anywhere, the growth will be restricted and you can have or experience miscarriages. It depends upon the location, the size of the fibroid, right? But during fetal development, even if you are having a bulky uterus, if it is in a milder form, then that is okay. But if the bulky uterus is very severe, the symptoms are severe, or if the bulky uterus is really thicker and you're feeling lower abdominal swelling, you have to understand that the bulky uterus itself demands blood supply. So the blood supply to fetus is decreased. So fetus development will go down. First thing. Second thing, because it is bulky uterus and it is already expanded to a certain amount or certain size and shape, as you progress through your pregnancy, the expansion of the uterus is too much and it can lead into what is called as preterm labor. That is, you can experience labor in the 7th month, in the 8th month also. And some people even earlier if they have really thick or bulky uterus, not getting blood supply. And apart from this preterm complication, you might experience another one which is called as fetal restriction. Why? Because bulky uterus is thick, it's not expanding properly, the fetus is not able to move properly, it is constricted, hence it can cause fetal restriction. And if it is complicated with fibroids or endometriosis or adenomyosis or PCOS, the number of complications increasing, the number of it is that difficult to get pregnant first of all, and then after pregnancy also it is problematic to carry the baby properly, right? This is how bulky uterus will impact pregnancy. So should everybody be worried about this bulky uterus, or should every person who's suffering with bulky uterus? Then no, it is important that you take certain considerations. First one is individual variability. It depends upon your family history, on your lifestyle, on your hormonal level, on the complications that you have, like if it is super added with something or not. Even if two persons who are suffering from bulky uterus in the same family, both of them might not be experiencing same symptoms. Even if the symptoms are same, the hormonal level might not be the same, or the body reaction might not be the same. So it is important that you consult a doctor and not someone who has the same disease. To don't go for advice to a person who is already suffering from this disease, because their experience might differ from your experience. Second thing is the underlying cause. It's always important to know what is the underlying cause of this bulky uterus. Is it the hormonal fluctuation? Is it the fibroid? Is it endometriosis? Or is it endometrial hyperplasia? What is the underlying cause, and what are you doing to decrease the cause or decrease the trigger so that this bulky uterus will come back to the normal size? Okay. So understanding cause is important, knowing that you're an individual is important, and apart from that, early diagnosis and management is important. If you're someone who's going to get married, get this simple test done. First and foremost simple test done that you have to do is get a CBP, which is complete blood picture. Second one, get compulsory USG scan to know if there is any underlying cause, and might be you might not have had symptoms of it, or even if you're having symptoms, you did not track your period properly, so you do not even know what the symptoms are. And the third thing, apart from USG scan and CBP, try to get a lipid profile done, because hyperlipidemia can sometimes cause or be a background cause for hormonal imbalances. And then what is the fourth test? Get a hormone profile done. In hormone profile, include every hormone, LH, FSH, prolactin, and then estrogen, progesterone, and even testosterone, and even AMH, which is anti-Mullerian hormone. So by having an assessment of the hormones, having an assessment of the internal parts of the body, that is the uterus and the reproductive system, and then having an assessment of the quality of blood, if everything ticks okay, you're good to go. If there is some problem, having an early diagnosis, it will help in good prognosis, and it will not complicate the case. So it will be easy for you, and you will be able to come back much stronger if the diagnosis is much earlier. Then coming to the conventional form of treatment or allopathic form of treatment. So if you're someone who's suffering from bulky uterus, what would a gynecologist suggest you? The primary thing that they would suggest is hormonal therapies. It can include COCs, which is combined oral contraceptives, or POPs, which is progesterone only pills, or it can include GnRH agonists, or it can include Mirena, which is IUCDs, which is an instrument which is put into the uterus. So these all have certain side effects attached to it. What are they? Weight gain, and then hair loss, and then you will experience the body becoming much oilier, face becoming much oilier, cystic acne, nodular acne, severe mood swings. If the Mirena or the IUCD is misplaced, it can cause uterine perforation. They do not give any sustained, reliable cure as such for this symptoms. Second thing is having non-hormonal therapies, which is NSAIDs or painkillers. If you're using a lot of painkillers, your kidney might be damaged if you're using it for a prolonged period of time. Apart from that, if you're using NSAIDs, you have to use it with a proton pump inhibitor, which on a longer run can cause nutritional deficiencies, because there is improper absorption, and also the gut bacteria can be destroyed, and also the immunity can come down because of nutritional deficiencies. And then surgical options, if you're getting your myomectomy done, which is just fibroid removal, or DNC done, which is taking away the excess endometrial layer, you can have a recurrence, because we have many patients who are coming to us after myomectomy or after DNC. They are having again bulky uterus, they are again suffering with fibroids. They can again have fibroids in the same place also. So that is important. And second thing is hysterectomy. If you're a person who hasn't been pregnant, then hysterectomy might not be an option. And if you've already planned your pregnancy, you have your kids, but you're very young to get a hysterectomy, then you might be having low calcium blood level, and also it can lead into fragile bones and osteoporosis at an early age. You will experience menopausal symptoms, hair fall, and then skin becoming a little bit drier, not plumpier as it used to be. Collagen breakdown is much faster, and then either become too fat or too thin. You can experience hormonal imbalances, like even thyroid hormonal imbalance. So we don't want all of these side effects. We want a medication that is proper, and that gives you effective cure, which is nothing but homeopathic form of medication. Here we analyze each and every person, individual person, their mental picture, their stress response, their physical symptoms, how is their body, what is their family background, what is the hereditary symptomatology that they have developed, if there is any, and how is the response to everyday problems that they are facing. So by understanding the link, evaluating the cause and giving holistic medicines which is safe and effective, your hormonal imbalance will come down, the hormones will be balanced out, menstruation will be regularized, the fertility rate can increase, the cure is obtained, and also recurrence after using homeopathic medications compared to allopathic form of medications is very, very less. Now coming to the consultation options, at Fidicus Homeopathy we have two kinds of consultation options. One is online consultation option and the other one is offline consultation option. If you're someone who's staying the nearest branch of Fidicus, you can come and contact us in person. And if you're someone who's staying far away from us, you can contact us online through audio consultation or through the video consultation option. Once the consultation is done, once you have had your investigations verified, especially to online clients, medicines will be door delivered to you. If you're staying in India, 3 to 4 business days. If you're staying in USA, 3 to 5 business days. Anywhere across the globe, we can take 4 to 8 business days for our medicines to reach your doorstep. If you want to get in touch with us or contact us, you can call us, WhatsApp us, or messages on this number which is displayed on the screen. And if you'd like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. Here we have discussed how homeopathy has a better choice in treating these lifestyle disorders or these female reproductive organ diseases. Here we'll be discussing how Fidicus Homeopathy is the best choice in homeopathy. Fidicus Homeopathy stands for highest chance of health. Here we follow 3 principles. The first one being highest success rate. Here we are already experiencing high success rate in treating endometriosis, adenomyosis, bulky uterus, fibroids, dysmenorrhea, ovarian cysts like hemorrhagic cyst or chocolate cyst, or even cervical erosion as for that matter. So apart from having high success rate in all of these female reproductive diseases, we have transparent treatment. What is transparent treatment? There is no gray area between the patient and the doctor. Here the prognosis will be clearly explained to you. And apart from that, the personal care here at Fidicus Homeopathy is top notch. Any sort of queries, myths that you have, questions that you have, everything will be answered. So if you want to choose cure, if you want to choose health, choose Fidicus Homeopathy. Thank you.